Hello, and welcome to the Stella Life Innovators series. I'm Liz Lundry, and today I have the pleasure of speaking with Dr. Sammy Noumbissi. Dr. Noumbissi is a master of implantology with published abstracts and articles in peer-reviewed dental journals. He lectures internationally and focuses his research on bioceramics and their use as regenerative, implant, and restorative materials. He's the founder of the Ceramic Implant Training course program and the founding president of the International Academy of Ceramic Implantology. Welcome, Dr. Noumbissi, and thank you so much for joining us today.
Thank you. Thanks for having me. It's a pleasure.
Really, I'm happy you're here. I know how busy you are. I appreciate your time, and we're excited to learn from you today. So I'd like to ask you some questions, beginning with, what are the advantages of ceramic implants?
Well, ceramic implants, first of all, are not as new as most people think. If you look back at the history of dentistry, some of our ancestors, before even the Middle Ages, were already implanting seashells, and we know seashells are a form of ceramics. Now, fast forward to more contemporary times, ceramic implants have been investigated since the early 60s, late 50s, and one of the pioneers I always like to refer to is Professor Sammy Noumbissi from Switzerland, the late Professor Noumbissi, who in 1958-57 was already producing ceramic implants. So today, ceramic implants are now growing in popularity. And the reason for that is, there's many reasons for that. One is that the conventional implants, the titanium implants, the titanium alloy implants, which have been around for close to 5 decades, and have done very well, we're understanding better how the body responds to those implants and how those implants affect also the body. And we have come to realize that titanium and titanium alloys are not as stable in a oral environment or in the body in general as we originally thought. And one of the main problems we're seeing is the issue of corrosion. We have these dental and also orthopedic implants that have a tendency over time, because of usage or because of exposure to oral fluids or body fluids, to break down, and they corrode. And once they corrode, they release metal ions into the lymphatics, the bloodstream, and that in some patients can really cause some health problems. So now here comes the ceramic implants. They're not new, like I said initially. They've been around, but they have been perfected. The original ones were not very good. They were not very structurally sound, especially to chewing forces. And in the last 25 years or so, the materials used to make ceramic implants have been vastly improved. And they've been improved to the point where today we have ceramic implants that are 2-piece, just like titanium implants. We even have ceramic implants that are starting to offer angled abutments, just like in titanium implants. Of course, ceramic implants do not have the full range of prosthetic solutions titanium implants have, but the advantage is that they are metal-free, they're corrosion-free, they do not degrade and release any types of ions in the body, and they're hypoallergenic. So there's no documented or recorded reports of an allergy or a sensitivity to zirconia or ceramic implants. So those are the advantages of those implants. Plus, there's the aesthetic side. With titanium implants, sometimes over time, you tend to see a gray shadow through the implant or through the gums, whereas with ceramic implants, you don't have that. So they have that they've always had that aesthetic edge. And now they have caught up in terms of mechanical strength, and they are way ahead of metal alloys in terms of keeping their structural integrity when exposed to body fluids or the oral environment.
Yeah, absolutely. As a hygienist of over 40 years, I've seen the evolution of implants, and then when they fail. Sometimes it's for all of the reasons that you're describing. So with these implants, we have the biocompatibility and still have great integration, right? And because we don't have that corrosion, there should be a more long-term result, with stability for these implants. So that sounds so great, kinder to the body overall, which is, I think, a key. And I think more of us are looking at that, as we look to the future. So where can doctors go and learn more about these implants and this technology and the placement and applications of it?
Well, there's like traditionally it's been a lot of times we have the manufacturers that offer their training opportunities, usually, of course, geared towards their product and specifically towards their product. Well, we at the International Academy and also at the Ceramic Implant Training course, we are teaching the concept, the material, and the philosophy. And what do I mean by that is, first of all, why ceramic implants? And for some of the reasons I explained before, the no corrosion, no allergic reactions to them. And also they stay very clean. Ceramics have a tendency to not accumulate plaque. So where to learn? I always suggest, I get this question all the time. I always tell, well, the first thing a practitioner wants to do, especially if they want to bring ceramic implants into their practice, is to spend time to understand zirconia, understand implantable ceramics. How do they work? What are their limitations? Because like any material, they have their limitations. What can you do and cannot do with them? And the best place to learn about these things is in an independent environment. And I always recommend that the first encounter should be very, how will I say, a light encounter. So go to a lecture, come to our meetings. We have an annual meeting every year. The next one is coming up in May. It's going to be in Washington, D.C. Come to those events and just look at different speakers talk about different implant systems and showing the range of cases they have been able to accomplish. Today, we have speakers that come and can show 15, 20 years experience with ceramic implants. Personally, I have about 13 years experience with ceramic implants. So they can learn about this at the academy. They can come to the ceramic implant training courses. All that is listed on the academy website, of course. And, but the first contact, I think, should be light, because it's getting involved with ceramic implants has to come along with other changes in the practice. Okay. For example, I'm going to give you an example. For example, over the years, from my experience, I'm learning from my peers, we have found that ceramic implants do well if a patient is healthy. So, whereas titanium implants have an ability to integrate and function in very challenging environments and people with a challenged health. So we know, for example, that whether the implant is titanium or ceramic, the patient has to have a good level of vitamin D. The patient needs to be able to heal from that surgery, and that also involves cholesterol, HbA1c, and a lot of systemic factors that can affect the success of the implant. But ceramic implants in particular are very, very sensitive to unhealthy individuals. The osseointegration in a diabetic patient of a ceramic implant versus a titanium implant is not going to be as good. So that being said, the clinician now has to up their game, so to speak. And what I mean by that is probably in many cases, some blood work needs to be done prior to doing surgery. In dentistry, we do a lot of surgeries without even really doing blood work. And for the most part, they're successful. But if you're going to get involved with ceramic implants, it requires a more discipline, more diligence in the majority of cases. So you have to evaluate your patient. Is your patient healthy enough? Do they have good bone? Because sometimes general health translates into poor bone or poor bone healing. Can they recover from the procedure that you're going to do? Because a surgical procedure is essentially an injury that the patient has to heal from. you know? So learning, even if you have vast experience with implants, I had 11 years of private practice experience, plus 3 years of residency in implant dentistry. But when I got into ceramic implants, I had to take it slow. Get some learning, training, get some mentors, go to courses, and that's how you really get into it. Because just purchasing a kit, going into surgery is not the best way to implement that in your practice. Failures are going to be high, and all kinds of untoward events could happen, and it would just make you not want to continue to a doctor not continue to use ceramic implants.
Yeah, absolutely. I think those are some really good points, but I think what's really critically important that all of us really should be looking at as clinicians is that we are on the forefront of detecting other diseases of the body. And we also have an opportunity to educate our patients about that oral systemic link that we're so familiar with. And I think we're seeing a trend with more doctors integrating, some testing, at the very least salivary diagnostics, but also having blood work done for these patients, because we can do so much more for these patients' lives, than just take care of their teeth, which is really just the beginning. Is kind of superficial when we really look at the big picture. So I think that regardless of what we're doing, this is something that everyone should be, having that opportunity to really help our patients. And this is a great way, to take a deeper dive and really support their health. So yeah, there may be some initial difficulties with just learning things differently, that learning curve. But I think that we're seeing more and more doctors appreciating being able to provide that for their patients. So I think that's really great. So can you tell us about what will be offered at the upcoming IAOCI World Congress in May? I know you're going to have lectures and, will there be hands-on? Can you just talk about that course coming up?
Yes, it's a very rich event. It's going to be 3 days. It's going to be from May 19th through May 21st. And it's going to be in Washington, D.C. It's a great time of the year to be in D.C. The weather is mild, and it's just a very nice environment at that time of the year. And we're going to have on the Thursday, the 19th, we're going to have a first day that's going to have workshops. And those workshops are going to be about bone grafting, site preservation, site reconstruction. There's going to be also a workshop on the dentist well-being. We're going to have a speaker that's going to really address how stress affects dentists and how they should manage it, and just be able to stay healthy in their practices. We're also going to have three or four implant systems, different implant systems that are going to offer hands-on. So the participants will be able to go and feel and get a close one-on-one experience with different systems. They're also going to be exhibitors of different implant systems, ceramic implant systems, and other dental-related technologies, lasers, photobiomodulation, homeopathics, such as Stella Life, which has an amazing plus, especially in oral or periodontal surgery, whether it's ceramic or metal free. So there's going to be a lot of really avant-garde information and technology and science on the rehabilitation of the oral cavity. The metal-free concept, the homeopathics concept, because we now know there's a lot of literature out there that shows that some of the products like chlorhexidine, we believe, were the best products for recovery or for just treatment are not really good. I mean, chlorhexidine corrodes implants. So there's just going to be a wide array of speakers, of programs where it's not only going to be about the implant, but it's also going to be about what's around the implant, the patient, and the kinds of care that can be provided to have everything work as one.
That sounds great. And it sounds like it's going to be very exciting, very innovative. and a great place for somebody who's just thinking about doing it to get started and have this great
That's right.
introduction. Also for those that are already placing it so they can learn more. So it's going to be
Yeah.
a great event. So I hope that all of you out there who are listening in will really consider going to this and attending this amazing course. And I'm excited about it. So thank you so much for what you're doing, for patients overall, for providing them an opportunity to have really great health and having alternatives to what we've had in the past and has been commonly used. And Doctor, thank you so much for your time today. I learned something and really am grateful that you were able to share this information with us. So looking forward to seeing you again soon. And for everybody else out there, thanks for joining us today. And join us next time. We'll have another amazing innovator, like Dr. Noumbissi, and we can all learn some more from them. So until then, stay well and take care of yourselves and each other. Thank you so much.
Thank you very much, and thanks for having me.
Thank you, Doctor.